I'm just waiting for Selvaraju to unmute and say a few words. Selvaraj, I can't hear you. There is some problem with the audio.
I think he's unmute now.
You need to unmute, Selvaraj. அந்த மைக் இருக்கு பாருங்க, மைக்க வந்து அந்த ரெட் கலர் கிராஸ் இருக்கும், அதை கிளிக் பண்ணுங்க. We have 1 minute.
Shanti, this is my sister Nandini.
Yeah, she came. Yeah, so nice.
Yeah.
So I'm starting the recording. We are already on Facebook Live. Selvaraj, don't worry. You have your phone with you, Selvaraj. Call me, in my phone. I'll put it in my speaker. Okay? Your audio. Okay? Selvaraj, yes? Show me your thumbs up. Selvaraj?
He's frozen, I think.
It's not.
But Shanti? Hi, Shanti.
Hi.
You have become an expert. You have become an expert in this.
No, I'm just learning. Selvaraj, I will call you, okay? We're going to start the program now.
Good morning, afternoon, and good evening to everyone. It is my pleasure to welcome all of you to Project Murali's webinar about taking charge of your health during pregnancy. A few words about this project and founder Dr. Shanti Raj, pediatrician and autism specialist. Dr. Shanti Raj is an American board certified pediatrician with 30 years of global practice. She has experience serving children with autism, ADHD, and learning disabilities. As a certified autism specialist, she's trying to build a well-informed community for children. She is presently a member of the American Academy of Pediatrics and a lifetime member of both the Indian Academy of Pediatrics and the Indian Medical Association. She has a keen interest in practicing yoga and meditation. The mission of this project is to extend compassionate support and make a difference in the lives of children with special needs. The goals are to spread awareness on developmental challenges and disorders such as autism spectrum disorder, ADHD, learning disabilities, and other conditions. To educate parents and caregivers on contemporary approaches to deal with the developmental delays and disorders in children, and provide treatment and support through online consultations. Dr. Shanti Raj provides free telemedicine consultations. Objectives are to emphasize early intervention and diagnosis, spread accurate information on assessments, diagnosis and treatment for children with special needs, build a network of multidisciplinary teams to provide holistic treatment and support to the children, the caregivers, and the communities, and provide access to resources and facilities to the clients. Over to Dr. Shanti Raj for a keynote address.
Greetings from Project Murali. I welcome you all for our second webinar in creating global awareness on developmental disabilities in children. I would like to thank our eminent speakers, Dr. Geeta Arjun, Dr. Mala Raj, for readily accepting my invitation. My special thanks to Dr. Selvaraj, our guest for the evening today, for supporting Project Murali. I'm excited to share some news on the progress of our project. We have formed a parent support group, which will be a great resource for all our parents. Thanks, Vasanthi. We are planning to release short videos every month, and parents with special children will benefit by watching other parents who have gone through the same in their lives. And we have our own website, www.projectmarlai.com. It's getting ready with a skeletal framework done by Sriram, and I appreciate all his efforts. And we are looking forward to expanding our team. I'm welcoming Dr. Sudhakar. He's IAP Secretary of Tamil Nadu. He's running a project called Smilestones, which is like Project Marlai. Looks like he started this in 2015, and he's been conducting camps traveling all over Tamil Nadu to screen children with developmental disabilities, especially autism, ADHD, and learning disability. I happened to talk to him to get the list of IAP doctors, and I was so thrilled to hear his vision. He's like my counterpart living in Tamil Nadu, who has started the project for the last 5 years, doing such a wonderful job. And I'm so happy to connect with him, and we are planning to work together to carry forward our vision. And we want to reach all the special children in Tamil Nadu to get our services. And we are still doing telemedicine online. I'm able to reach to the remote places in Tamil Nadu. I talked to a few parents in Tirupur, Salem. We are having a new number through Google Voice. It's 903. 903. I'll share the slide now. Give me 1 second, please. Yeah. So the number is 833 49409. This number is in WhatsApp. If anyone can connect with me through WhatsApp message, I'll be able to talk to them through video call. And I'm so glad Madhavan helped me in getting this number. Also, Mr. Madhavan is going to help us in translating to Tamil in our website. Our reach should be to all those underserved people in the remote places of Tamil Nadu. In the process, we'll be doing Tamil programs also. In the ப்ராஜெக்ட் மழலையில் உங்களை வரவேற்கிறதுல எனக்கு ரொம்ப சந்தோஷம், ரொம்ப மகிழ்ச்சியாக இருக்குது. நாங்கள் தமிழ்லையும் இந்த ப்ரோக்ராமை கண்டக்ட் பண்ண போகிறோம். டாக்டர்ஸ் வந்து தமிழ்லையும் உங்களுக்கு எக்ஸ்பிளைன் பண்ண போகிறாங்க. நம்மளுடைய ப்ராஜெக்ட் ஸ்லோவாக டெவலப் ஆகிட்டு யாருடைய கஷ்டத்தையும் தீர்க்கறதுக்கு, குழந்தைங்களுக்கு ஹெல்ப் பண்ணுறதுக்காக உலகத்தில் எங்கே இருந்தாலும் நம்ம தமிழ் மக்களுக்காக இந்த ப்ராஜெக்ட் ஆரம்பிச்சிருக்கோம். பட் மெயின் நம்மளுடைய கோல் வந்து எந்த குழந்தையால பேச முடியலையோ அவங்கள பேச வைக்கிறதுக்காக தான். அண்ட் எஸ்பெஷலி ஆட்டிசம்ங்கிற கண்டிஷனை சீக்கிரமா டயக்னோஸ் பண்ணி தெரப்பிஸ் ஆரம்பிச்சா டெஃபினட்டா அவங்கள இன்னும் இம்ப்ரூவ் பண்ண வைக்கலாம். தேங்க்யூ ஸோ மச். ஓவர் டு அவர் ஸ்பீக்கர்ஸ்.
Now I would like to introduce our guest of honor speaker, Dr. K. Selvaraju. Dr. Selvaraju.
Yeah, can you hear me?
Geologist.
Dr. Santi?
Specialist in Chennai, India, and is the secretary of the Tamil Nadu and Mother Teresa Foundation. He's a medical wing secretary of the Tamil Nadu chapter and International Human Rights Organization. He is also a district secretary of the medical wing in South Chennai and is also a social activist.
Over to Dr. Selvaraj, please.
Can you hear me, Santi?
Yes. Can you increase the volume, please?
Yeah. Sure.
Go ahead. Yeah, I can hear you.
Yeah. First of all, I thank Dr. Santi for giving me such a great opportunity for participating this type of webinar. Okay, it's a great honor for me for inviting me in this webinar. Okay, So can you hear something?
Yes, yes, you're good.
Hello?
Yeah, I can
Okay.
hear you. Yes.
Okay. Okay. So first of all, I thank you very much, Dr. Shanti Raj, for giving me this chance for speaking with all eminent delegates, okay, in front of you. It's a great honor for me for inviting me in this webinar, okay. And Dr. Shanti Raj and myself are classmates in UG. In MBBS, we have been together in Stanley Medical College, and she became a pediatrician practicing pediatrics in India and in US throughout the world through telemedicine. Okay, but I chose the field of anesthesia and intensive care, but Shanti's interest was pediatrics. The two, she's taking much of care of autism children and hyperactive and problems with learning disabilities. She's doing a good job for the poor patients and the needy one. So this autism become nowadays it's a very biggest problem in our society, and the learning disability is keep on increasing, and people are struggling. Parents, in fact, parents are struggling what to do and what not to do with their children. The early diagnosis of autism is very much important so that we can give them therapy and make them at least not full normal. We can bring the children to a near normal one. So for that, she's doing a great service throughout the world. I thank Dr. Shanti Raj for doing such an excellent work in this field. And I thank Dr. Malaraj. Malaraj is my neighbor in Ananagar and practicing in Chennai. He's the leading laparoscopic surgeon I know her for the past 15 years, more than 15 years. So Malaraj is doing his good job, and she's going to give a good talk on women's health. And Dr. Geeta Arjun is a senior doctor of Kalyani Foundation. She is going to talk about pregnancy. So I thank everyone for giving such a nice opportunity and doing good thing for the society. So what I want to convey to the people of Tamil Nadu and people of the government, the government of Tamil Nadu, see, in cities like Chennai and bigger cities, the children with autism, they diagnose very quickly and they give therapy. But in village people, it's very difficult to find out the early diagnosis of autism. So in fact, we were struggling for a lot for the pick up the autism child. So the government has to make necessary step to start with autism centers in that particular village setup now, so that the people in village can improve. So most of the pediatricians they are not trained in this type of children's problem, autism and hyperactive problem. They have to undergo such undergo training in this type of disabilities, and they have to do something good thing for the society. So I thank once again my classmate Dr. Shanti Raj for giving me such an excellent opportunity in participating in this type of webinar. Thank you, Shanti Raj. Thank you.
Thank you, Dr. Selvaraj.
Thank you very much, Dr. Selvaraju, for your interesting talk. Now, I would like to invite our next speaker, Dr. Geeta Arjun. Dr. Geeta is a graduate of the Madras Medical College and a fellow of the American College of obstetricians and gynecologists. She's the director of the E.V. Kalyani Medical Foundation and the organising secretary for the Progress series of conferences. She has authored many books, such as A Passport to a Healthy Pregnancy, A Practical Guide to Obstetrics, The Essentials of Obstetrics, The Management of Labour, and A Healthy Guide to Pregnancy.
Over to Dr. Geeta. Ma'am.
Good evening, Shanti. Thank you so much, and the team of Project Mirelay for having me on this webinar. It's certainly a pleasure, and I think the work that you're doing is going to have far-reaching effects, and I think Tamil Nadu is going to benefit because of that. I'm just going to start sharing my slides. Give me a minute, and we are on. Okay, right. So what I'm going to talk about today, and let me just set my timer, please. 1 second, give me a minute. So that, right. So what I'm going to talk about is pregnancy is obviously a very, very common thing. And particularly in India, I don't think we can get over the fact that we are producing the largest number of babies in the world. But the thing is, you can't just get into pregnancy without having any thoughts, and you must take charge of your health when you are pregnant. And this ultimately has far-reaching consequences. It has amazing effect on the baby. So the first thing that you have to do before getting pregnant is thinking about pre-pregnancy counseling. And why is this very important? I always believe that there should be no unintended pregnancy. You know, what I call the oops pregnancy. Oops, I'm pregnant. I don't think that should ever happen. I think women, particularly educated women, particularly women who have a life plan for themselves, should go through this whole process of thinking before pregnancy, planning a pregnancy. And this is important because you go meet your doctor, you go through a whole set of tests and investigations, or more importantly, even just talking to the doctor and bringing out your concerns and deciding what you should be doing next before you get pregnant. And this is part of taking charge of your own pregnancy. Even before you get pregnant, you have already decided that this is going to be a pregnancy that I have planned, that I want it to go well, and I'm going to do everything in my means to be able to do that. One of the most important things, and in India, when we grew up, famine was a reality, starvation was a reality across the country. But now 1 out of 5 women in this country are obese. So we also are facing this huge problem with obesity, overweight. And so pre-pregnancy counseling, the first thing, one of the most important things is that you have to look at your weight. You start off with what is your weight even before you get pregnant. Try to optimize your weight, and I'll talk to you later on in this talk about how important that is. So first thing that you have to do in your pre-pregnancy counseling is meet your doctor for your height. What should your weight be, and how do you optimize it? You have to check for high blood pressure. You know that in India, we have one of the largest caseloads of high blood pressure, diabetes. So you have, especially if you have a family history, meet your doctor, make sure that, you know, if you are already have high blood pressure, then check and see what tablets you should be taking. Or if there's a family history, then there's an increased risk of getting high blood pressure during pregnancy. So then you figure out how you can plan your pregnancy, so that you can avoid high blood pressure in pregnancy, diabetes in pregnancy, and most importantly, start on folic acid. Now, folic acid is also known as the engagement drug. That is, when you get engaged, you start on folic acid. Why is it? Because we know that this particular vitamin is very, very important in avoiding certain abnormalities in the baby, especially spinal cord defects. And so it's important that you start folic acid. because you should be on it for at least about 3 months before you even attempt a pregnancy. So it's not that you should, if you have not had folic acid, it's going to harm the baby, but certainly a certain amount of folic acid, increasing your level, keeping it at the right level will make a big difference for your baby and your baby's health. And then you should read whatever you can and find out and know about your pregnancy. Now, this is a miracle when two cells, the ovum, the egg from the woman and the sperm from the man, when fertilization happens, it's really a miracle. You take just two cells and then it produces a human being made up of billions of cells, which can do everything. We can talk and sing and speak and dance and breathe and smell. I mean, it's just amazing what these two little cells can do. And it's a miracle. There's no question about it. But just before we go on, I just have to say this little thing for people who already are mothers or have been mothers for a long time, and or who have been married for a long time. This is something I just want to, because a miracle is fantastic. The baby is great. After a while, certain things happen. And then as the babies grow up, you have to set it free, because one of the biggest things, the best thing that you can do for your children is let them go, let them roam, let them find what they can do. So if you love something, set it free. If it comes back, it was and always be yours. You don't have to cling on to your children. But if it just sits in your living room, messes up your stuff, eats your food, uses your telephone, takes your money, and never seems to know that it actually was set free in the first place, you either married it or gave birth to it. Okay, so this is just for all the mothers who already are there and wondering when your babies are going to leave the nest. This is just a little thought for you. Okay, before we actually go on to the other things in pregnancy, I think the most important thing is eating healthy in pregnancy, because the minute you get pregnancy, your mother, your mother-in-law, your next door neighbor, pakate aata mami, everybody gets into this thing about frenzy about start eating, you're eating for two. And women just let go of everything and say, yes, now I can eat. But eating healthy in pregnancy, I think this is a focus which has been a focus of my practice for years, for decades. I always told women, know your weight at the beginning of the pregnancy. We used to always calculate the BMI, tell the mother, okay, your BMI, your body mass index is so much, you can only put on so much during a pregnancy. If you started off with a normal weight, you cannot put on more than 10 kilos in a pregnancy. And to do that, make sure that your food is very balanced, and a lot of it has to be plant-based. And I think that is something that everybody should get this message across. Plant-based food is excellent for you. It's basically, I'm not saying become a vegetarian. I'm not a vegetarian, but plant-based food is very good, particularly in pregnancy. And eating for a healthy pregnancy, I think there are certain things that I truly believe in. And I will come more to the rules of two, but 2 glasses of milk, 2 cups of curds, 2 katoris of vegetables, 2 katoris of fruit or 2 fruits. If it happens to be bananas, maybe you can have 1 banana, 1 guava, 2 cups of sundal every day. And I believe that is such a good source of protein. So that gives you, and it also keeps you full. You're not eating junk food. You're not eating other stuff just because you're hungry. And drink lots and lots. There you don't stop with 2 glasses of water. You have lots and lots of water. Hydration, especially in a place like Chennai or in Tamil Nadu, where we are hot and sweating all the time, keep yourself hydrated. And it's extremely important. Everybody talks about carbs, right? For everybody, leave alone pregnant women. Carbs are very, very important, and it's something that we have to pay attention to. Okay, the moment you talk about carbs, everybody gets into this argument. Should we be eating rice? Should we be eating chapatis? I remember one patient who came in and she was putting on 2 to 3 kilos every checkup. And I was just going nuts because I was trying to figure out what was happening. We've been giving her advice on not to eat too much. And her mother sat next to her and says, "Onnume sapradilla, madam." I said, "Onnume saprade, epdipa 3 kilos ஏறுது?" She said, no, sadame sapradilla. So going through this complete, like a detective, sadam sapradilla, how is she putting on weight? So I said, "Appo karthala enna sapradhu?" Oru 4-5 dosa dhan sapradhu. அப்புறம் மத்தியானத்துக்கு வெறும் இட்லி தான் மேடம், சாதமே சாப்பிடுறது இல்லை. அண்ட் தென் ராத்திரி அதே தான் மேடம், மத்தியானம் இட்லி சாப்பிட்டுச்சுன்னா ராத்திரி சப்பாத்தி, ராத்திரி தோசை. I said, எல்லாமே சாதம் தானேம்மா. So that your concept of rice is bowls of rice, big mounds of rice on your food, on your plate, and definitely not. I think moderation. If you're going to have rice, have it once a day if you're talking cooked rice, and have it for lunch because you don't want to eat very heavy at night. And you have 2 cups of small katoris of rice. Fill yourself up with sambar, vegetables, all the other things that you're going to have. And when it comes to chapatis also, it's not like if you eat chapatis, you're not eating carbs. It's the same thing. It's the rule of 2. You have 2 chapatis. You can't have a basket full of chapatis in front of you, watch TV and eat them, and somebody saying, "Oh, you're pregnant, please have 2 more, have 2 more." So rules of 2 is not 2 more, it's only 2. You stop with 2, okay? So that's important. And idlis, oh my God, the number of times I've asked people, how many idlis do you have? And they only say, "Nalanji dan, anjaru dan, 6-7 dan." And the dan da, it used to drive me nuts because really you can't have more than 2 idlis. You cannot and should not have more than 2 idlis. They'll say, "Romba chinna idli, pressure cooker idli." But basically it's idli, it's carbs. Okay, it's very good. It's a good food, but certainly you can't be eating that much, that many calories. Have 2 idlis, fill yourself with the sambar, have some fruit, have a glass of milk. So that's important. Okay, rule of 2. Proteins are very, very important because that's what builds up your muscle. It builds up the baby's muscle. It's the building block of the baby. So definitely important. And for vegetarians, the lentils are very important. Have sundal, you can have a chana, you can have any amount. Non-vegetarians can have meat and eggs. Eggs are, I think, a perfect food. It's protein. The white of it is protein. The yellow, the yolk is good cholesterol. So certainly you can eat all this and it's very, very, very good for you, right? One question that comes up all the time, how much caffeine can I have? Can I have tea? Can I have coffee? Because everybody, especially your aunt sitting in Canada, will phone you up and say, "Stop, don't drink coffee. You're pregnant," So each one is giving you all these ideas, but basically you can have less than 200 grams of caffeine per day, which comes to about 2 cups. You can have a cup of coffee in the morning, or you can have a cup of tea in the evening. Either way, 2 cups of either coffee or tea are perfectly okay. It will not harm the baby. It's perfectly okay, right? But there are certain things you absolutely have to say no to, okay? And I know there are going to be lots of people watching who are going to say, "Oh my God, this is a horrible doctor. She says no chocolates, no cakes, no sweets." Oh my goodness. Yes, because I truly believe that sugar is bad for you. And this is a theory that everybody talks about. Keep less of white stuff on your plate, less white rice, less white sugar, less white salt, cut it down. I mean, once in a while is fine, but the thing is, sugar is addictive. Do not forget that, okay? And I have stayed away from sugar for a long time, and I'm not a diabetic. It's not because of that. I just feel it's not good for your body. And when it comes to alcohol, it is a complete no-no. You might have a chocolate once in a while, but you cannot have alcohol because it can cause fetal alcohol syndrome, and that can be very, very dangerous for the baby. So absolutely no question of young girls who want to have a glass of wine, want to have a beer, whatever, that's fine if you're not pregnant, okay? So that's absolutely a no-no, right? Supplements. Absolutely one of the important things, because you cannot get enough iron and enough calcium from your diet. You need iron. And if you're looking at iron, please make sure that your iron supplement says that it has at least 60 milligrams of elemental iron. That word will be on your bottle of iron. You should have at least 60 milligrams of elemental iron. Folic acid, anywhere more than 1 milligram, 0.4 milligrams actually, but anything more than 1 milligram is fine. That's all you really require, unless you've had a baby with a problem before, where your doctor herself or himself will put you on 4 milligrams or 5 milligrams of folic acid. And get a combination where iron, folic acid, B complex is there. And listen to me, just buy the cheapest one. You don't have to buy something which costs 13 rupees and 18 rupees a capsule. They're absolutely of no use. Take the cheapest one, 1 rupee, 2 rupee, 3 rupee iron capsules. They will work fine as long as it's ferrous sulfate or ferrous fumarate, it'll be fine. Calcium, if you're a good person who has been taking a good amount of milk and curds through your life from the time you were a child, you probably are not calcium deficient. But if you have not, then calcium is necessary. We know that the baby uses up the calcium in the mother. So calcium about 500 milligrams a day, and usually it comes with vitamin D. So you get the combination. So those two things are very important. And if somebody tells you, take something with DHA, okay? DHA is found in salmon and it's found in tuna. Those kind of fish, we can't even access. So I know that Ramanujam, the very famous mathematician, his mother was a pure vegetarian, okay? She never had fish in her life, but she had a genius. So you don't have to have DHA. There is no evidence. So don't buy things which have DHA because it just increases the cost of the tablet. Staying fit in pregnancy, again, one of my absolute important things that I have pushed throughout my career. You have to stay fit in pregnancy because that is what's going to make sure that your pregnancy goes well, your baby grows well. The other problem is that we know that women who are overweight or obese have increased risk of miscarriage, have an increased risk of developing diabetes in pregnancy, have an increased risk of getting high blood pressure in pregnancy, and have an increased risk of having cesarean section during pregnancy, end up with a cesarean section. So it's so important to stay fit and you will feel better. And the best way of avoiding this issue, a fat baby, an obese baby. Everybody will say, oh, it's a chubby baby, but this baby is going to face problems later on in life. It's going to have struggle with adult obesity. It'll struggle with diabetes, hypertension later on in life. So you don't want to have one of these so-called chubby babies or super big babies, okay? So the best way to stay fit is walking. I believe so much in walking for everybody, leave alone pregnancy. I think walking is the best exercise in the world. 45 minutes of brisk walking, not a stroll, okay? Not just a tiny little stroll where people are thinking you're walking along thinking great thoughts. No, you should be looking like you're running to catch a bus. You should be walking really, really fast. We used to run a passport to fitness as part of our obstetric care. We used to have a trainer working with our pregnant women. So if you can join a pregnancy antenatal class, I think it's fantastic, nothing like it. The biggest question that women have about their pregnancy is, how is my baby doing, right? What is the baby doing? How is it growing? And I think one of the best things that has happened in the past four decades is ultrasound. And ultrasound gives us a window into our baby. And here's a baby about 8 to 10 weeks, which is moving around. So we can look at the baby, we can see how it is formed, you can see the spinal column, you can see so many things. You can do a 3D ultrasound, which gives us a much better visualization of the baby. And most importantly, we screen for Down syndrome, which is the greatest reason for intellectual disability in babies. So screening for Down syndrome is very important and it should be done. Labor and delivery, the husband, I believe, should be there helping the mother It can be, just remember that there are breathing exercises you can do in pregnancy. You can make labor much, much easier than what our mothers and grandmothers went through, because the end result is always going to be very beautiful. But you can talk to your obstetrician earlier, try to talk to them about a painless delivery. Epidurals are available, certainly in the urban areas. So you can talk to them about it. And something that women always worry about, will I have a normal delivery? Will I have a cesarean section? And the one thing that you must do, and I believe, is staying fit is going to help you avoid a cesarean. Have a conversation with the obstetrician. Make sure that they know, she knows, that you absolutely are willing to go through anything to have a normal delivery. And most importantly, choose the right hospital. See what their cesarean section rates are. Ask them. I don't think any hospital should have a cesarean section rate more than 25%. And I think this is your right to find out from the hospital what is a cesarean section rate. Role of the father is extremely important. He should be involved in the pregnancy right from the beginning, going with the mother to the obstetrician. They're very good for giving massages. Okay, that's one of the great reasons to have your husband around when you're pregnant, for head massages, back massages, everything. They certainly have a role to play in pregnancy. We've allowed husbands in the labor room from 1981. It is so important to have your partner there and help you to go through it. And of course, right from the minute the baby is born, the father is bonding with the baby, and it plays a very, very important role in the growth of the baby. The last thing I'm going to talk about is pregnancy in the time of the COVID-19 pandemic, because everybody is concerned about it. The only good thing about this pandemic is that COVID-19 does not seem to harm mothers or their babies. And this is very important. From the data that we have till now, H1N1 flu, that is the swine flu was extremely dangerous for pregnant mothers, but COVID doesn't seem to have that issue. Babies are also coming out without any problems. So that is the one good news in this era of COVID-19. Thank you so much. I really, really enjoyed speaking to all of you. And I think Shanti will allow some questions at the end. Thank you so much.
Thank you very much, Dr. Geeta, for shedding light on the topic of being healthy during pregnancy. Now I would like to invite our final speaker, Dr. Mala Raj. Dr. Mala Raj has a diploma in advanced laparoscopy surgery and a diploma in reproductive medicine. She has been given awards such as the Best Doctor Award from Tamil Nadu, MGR University. She's the Secretary of Liege Tamil Nadu chapter and is currently a Managing Director of Firm Hospitals.
Unfortunately, Dr. Mala Raj is not able to make it for this lecture. She has some emergency, she had to take care. Instead, Dr. Sumati Premanand will take over. Actually, our MC is Michelle from New Jersey. She's an attorney. I forgot to introduce her. She's the one, introducing all the speakers. She's going to introduce Dr. Sumati Premanand now, who's replaced Dr. Mala Raj.
Dr. Sumati Premanand is a graduate of Madras Medical College. Her training is in gynecology endoscopy. She received a diploma in ALS in Germany in 2005. She's a member of the Flinders Institute for Atmospheric and Marine Sciences. She's a faculty and delegate of the international and national conferences and summits. Her areas of special interest are adolescent gynecology and reproductive medicine.
Over to Dr. Sumati Premanand. Thank you so much, Sumati. Can you unmute yourself, please?
start screen sharing. Hello, everyone. This thing came as a surprise to me suddenly in the evening. Uh, Mala was not able to join in because of some emergency. She called me and Shanti. Uh, I apologize to y'all in the beginning itself because I'm looking at these slides for the first time. These are Mala's slides, and please forgive me if I make any mistake. And basically, I would like to keep this as a talk between you and me, and the slides may be Mala's, but the discussion will be ours. Let's keep it that way.
Sorry to interrupt, Sumati.
Congratulations.
Sumati, it's so lovely. I don't think anyone has done this before. So we are doing it, for the first time. So this is going to be a unique presentation.
Yeah.
So Mala's ideas in the slides and your presentation. That is
this is
excellent.
All I Geeta ma'am, all I have done after I got this is try to put my name inside. That's all I have done. I really don't know what's going to come up in this slide. So, oh my God, I just hope I don't make a fool of myself. But okay.
I'm sure you're fine. You're fine. Go ahead. I'm with you. I'm with you. Actually, we did a trial. It's like a demo we did yesterday. Malaraj, Geeta Arjun ma'am, and myself with Sumati. Everything was fine. So Sumati knows what Mala would have presented. I'm sure it's going to be fine. Go ahead.
Okay, fine. Here, after talking after Dr. Geeta Arjun is always a challenge for the next speaker. She's such a charming lady. She's our teacher, and all women, especially gynecologists, would like to become like her when they turn 60, and she knows why I say that. Fine. Here we are to address women and health. Why is women's health so important? Because most of the times we are talking about communicable diseases. Now women's health has progressed from having to address communicable diseases to having to address the non-communicable diseases. What do we think when we talk about health? Are we just talking about physical health? No, we are talking about something like a holistic healthcare, which includes physical health, mental health, sexual health, and the reproductive health. Here, we are going to just focus on women and their reproductive age group issues. Basically, women come to our clinics in their reproductive age group for two different things. One is their obstetric problem, that is delivery and pregnancy related stuff. The other is gynecology problem. And most of the women who turn up at gynecology clinics come to us with problems which are related to the three things which you see here. PCOS, that is polycystic ovarian syndrome, or PCOS, fibroids, and endometriosis. About 60 to 70% of our population who attend a gynecology clinic specialty normally turn to us for these problems. So why are we talking about polycystic ovaries? I'm sure apart from the medical community, the non-medical community which turns up into the clinics have issues from starting from adolescent age group into the reproductive age group. And initially people used to come and say, எங்களுக்கு பீரியட் சரியா வரல, பீரியட் தள்ளி போகுது, என்ன ப்ராப்ளம்னு தெரியல. So in the years of practice, what we find is people come up to us and say, I have polycystic ovaries. Okay, so they come up with a diagnosis, and it is in your hands to see whether they really have polycystic ovaries. Is it overdiagnosed or underdiagnosed? About 80% of patients who come to my clinic turn up with a diagnosis already in hand. And all ovaries which have cysts are not polycystic ovaries. All ovaries which show multiple follicles which are small in nature are not polycystic ovaries. Sometimes it is an overrated diagnosis. A good gynecologist should be able to differentiate between where the patient stands depending on the clinical features, her ultrasound report, and her biochemistry. The incidence of PCOS worldwide is increasing. There is a huge epidemiological link between polycystic ovaries. It's a big range. It starts with irregular periods, heavy periods, infertility, then delivery issues, problems during pregnancy, problems at delivery, increase in cesarean section rate, obesity. Then when the same woman doesn't take care of her body, it probably leads to gestational diabetes, and later on to diabetes, hypertension, cardiovascular risks, increase in the incidence of cancers. And this is one disease, if women are able to recognize and if their clinicians are able to take good care of them, not just by way of medicines, but by instilling in them holistic care, which includes their physical health and which includes a great deal of lifestyle modification. And as Dr. Geeta said, it is very difficult to make patients come out of a complete carbohydrate diet. It requires a lot of motivation, a lot of understanding, both by the physician as well as by the patient, as well as the family, for the entire PCOD thing to disappear. Fine. I'm going to skip a lot of slides so that we get some interesting things. I am going to, okay, this is what I already mentioned. When we see, what do I do when I get a patient with polycystic ovaries? I see them as into age groups. I compartmentalize them into age groups. Am I seeing an adolescent person? Am I seeing a person who is having subfertility? Am I seeing a person who has gotten pregnant after treatment of polycystic ovaries? Am I seeing a patient who already has kids and is planning for contraception? Am I looking at a person who is in her 40s and looking at lifestyle problems, obesity, diabetes, hypertension, other cardiovascular disorders, and later on endometrial cancers, which is very common in patients who have not addressed their polycystic ovarian syndrome. We have a group of patients all over the world, especially in India, more so in Tamil Nadu. The idea is to get periods properly. Then the idea is to get babies. After this is done, women just give it up. We see the same woman who is about 20 kilos overweight and who will be running up to you later on for diabetes, hypertension, and other issues. So I'm not going to go into the criteria of polycystic ovaries. It lies in the domain of the gynecologist to decide whether the patient has polycystic ovaries, and I don't think this is the scope of this talk. The goal in PCOS is something which I would like to address. Definitely, when patients turn up with menstrual disorders, hirsutism, fertility issues, or lifestyle issues later on, it is better to compartmentalize these patients and educate them regarding the lifestyle modification, which is going to result in spontaneous resolution of their symptoms. That is part number one. Part number two, along with a little bit of medication, we will still be able to address it. Part number three, they need a long-term follow-up. If we are able to instill these three things into a patient in whom a polycystic ovary has been diagnosed, our goal is done. Our role as a medical practitioner is done. If we are not able to do that, and if we are able to give them only the treatment through medicines, I don't think it is a complete treatment. When a patient turns up to your clinic for treatment of polycystic ovary, it is definitely the scope of the doctor who is going to sit with that person and then explain, starting from menarche to menopause, what is the problem they're going to face. And unless this is really, really, really instilled into the person and the family, we are going to look into problems later on in these women. Okay. What is the relationship between autism and polycystic ovaries is something Shanti is going to tell us. I'm not going to address it. Why do we need to, Shanti, would you like to share your experience here?
You keep going, no? I'll add as we go.
Fine. So there is some, okay, this is Mala's slide. I still have to read up regarding this. There is an evidence showing positive correlation between androgens and the effect on the development of CNS, definitely. So this is something which we have to look at and address. Autism is disproportionately observed in males. Lifestyle management targeting weight loss and prevention of weight gain, it needs two things. I tell my patients it's like bank. People come up. I'm sure Dr. Geeta has listened to this. Much more stories from patients telling I don't eat anything. I don't know how I'm gaining weight. I am doing everything I can, but I am not losing weight. I tell them it's like bank. Okay? So you have a bank account. How does it increase? Unless you put in something, it's not going to increase. If you want to spend it, you have to withdraw and spend it. So when you have to maintain, when you want to turn into a negative balance, you have to put in inside less and then make your expenditure more. This is the only thing I tell people. It takes some time for them to understand because I don't know how it works in the Western countries, but at least in India, more so in South India, they come to see us not just for their problems. They come to see us thinking that we will get rid of their weight issues like this, which is so difficult. And I'm sure everybody will be able to understand this. I'm sorry, I'm running through slides. We'll just stop where it really makes a...
Sumati,
yeah,
we'll
sure.
just discuss, no?
Yeah.
So the testosterone during pregnancy affecting the fetal brain, it is still debatable. You know, in the last 30 years, what I've seen, there is a new research that's, strongly suggests a connection between PCOS and autism. But we have not proven 100% yet. They are saying, according to the study's authors, the results sheds more light on the effect of prenatal testosterone on the developing fetal brain and on the child's behavior later in life. But we do not know whether PCOS causes autism, but the link is, certainly intriguing. But we have not proven, that treating PCOS can lead to, reduced risk of developing autism in the future. This goes to everything, not only PCOS. What about the maternal, mental status during pregnancy? If mom is depressed, if mom is sad, and especially, we have to wait and see after this COVID times because of the pandemic, the world is affected. We are all in the lockdown on and what happens to the pregnant women and the fetal mental health. So we have to wait till next year, so we have lots of babies on the way because during COVID lockdown, procreation is the only recreation. We are seeing lots of babies, coming out. It's too early to say what's happening to the fetal brain development. Same thing with PCOS also. In my experience for the last 30 years, I've not had a significant number of cases. We have to do more studies to prove that PCOS during pregnancy because of the testosterone effect on the fetal brain causing autism. We have to wait and see. So I would worry about the mental health of the mother during pandemic. So we have to make sure even this program, the very reason why I chose women's health as the first topic to make sure all women in this world, especially pregnant women, are staying healthy, both mentally, physically, emotionally, and socially. So we have to convey that message to our audience here. So maybe when I'm going to talk about autism in the future, I will definitely show more studies and the research that's going on, connecting the link between PCOS and autism. Thank you.
Oh, thank you, Shanti. I have just one more question to you. What I would ask you is, are there any specific proven parameters in the parents which reflect as more cases of autism in their babies?
Well, that's a very good question. The thing is, when I was in medical school, that was in the 80s, late 80s, the incidence of autism was 1 in 1,000. We talked about it yesterday, right? So today, the number is 1 in 54. Even Dr. Geeta was mentioning, what's happening. Is it the lifestyle? Is it the eating habits? Is it the digital media? Is it the virtual world? There is nothing called, reality. It is the virtual reality, and especially growing children. In the first 2 years, the brain develops up to 98%. So I have small infants who are able to use the scroll down their mom's phone, calling the father, or doing FaceTime. They're not even 1 year. So what's happening to the brain? And what about the eating habits? The type of food, especially in the US, if you look at the content, there are so many additives, so many chemicals, I'm sure, the future, it's a big question. What's happening to the next? As you said, definitely it's a big yes. I'm worried about the future, and I'm worried about increasing number of autism. We have this TV, laptop, tablets, mobile phones, everything. We are using it for good reasons, but at the same time, video games, addiction, digital, problems, eye problems, leave alone our health problems, head to foot, because of the positioning, sitting all day, especially IT professionals, they get burnt out. So imagine a growing child in the first few years of life, and if they're going to be exposed to a screen, it's just a screen. They don't have live communication. So I call it an idiot box. TV is nothing but an idiot box because it's one-way communication. So there is no space for the child to develop expressive language. So the reason why we are seeing more and more autistic kids, they are not expressing themselves, they are receiving, but there is no eye contact anymore. Even quote normal kids, or even adults for that matter, we have our headphones on, we have the mobile phone, and when we talk, do we see each other? Do we make eye contact? No, we are like somewhere else, we are talking to ourselves. We are crazy, and this world is growing nuts, right? And the very reason we are doing this webinar is to create awareness on human health and to prevent more problems in the future. I will discuss more and more on the developmental disabilities in the future. We are doing monthly webinars. We will cover all about autism, ADHD, and learning disability. I will be inviting all the expertise from different parts of the world. Thank you. Go ahead.
I'm sorry for deviating from the talk, but I find instead of sharing slides, it is better to have a healthy communication with people like you. What do you think, Geeta ma'am?
I have
slides, we know what's
questions,
going to be the slides.
Yeah, let me know once you're done, the 3 questions I have from you. We will discuss that with Dr. Geeta as well.
Yeah, and I want you to ponder about one more question. You can answer in between anytime you want. Now that you mentioned about isolation of kids being more, the reason probably leading on to autism, are autistic children more common in nuclear families? This is something which has been in my mind. And is autism more in Western countries than in underprivileged countries or the third world countries? Is autism more in urban setup than in the rural setup? Are autism children lesser in villages? These are some things which we have to really find answers. I'm sure you have some answers with you already, or somebody, you should probably do some good research on that and publish papers, because I have personally, I think most of us have a feeling that we have deviated away from nature so much. And now that we are locked in because of COVID, you are literally being pushed back into the lap of nature, without maids, without cooks, without drivers, without anybody, and you're left on your own, and you're forbidden from seeing anybody else apart from your own family, whether you like it or not. So whether autism has anything to do with those things, Shanti, at some point of time, after the lecture or during the lecture, please interrupt me when you find answers, and then let's go on. But this has been there in the mind because I have a few classmates of mine who are super intelligent, who have moved to the Western countries, and at least 4 of them have one autistic child with them. They are parents of autistic child. I am surprised that from my batch alone, from MMC, there are 4 people who have autism in their own families, their progenies, which is a little worrisome.
Do you want me to answer now?
Yeah.
Do
you
want
you
to
have an
answer
answer
question?
now? Yeah, sure.
Okay. So when I was practicing in India, I used to get a lot of kids from the US and other countries, coming in and asking, what can I do to help him talk? So those are called the autistic features. We have 2 things. One is the primary and the secondary. So primary autism, you have like a genetic basis, and with the environmental problems, and they're talking about toxicity, and nutritional problems. Whereas secondary, this is because of the lack of stimulation. I have had very good success. Once these children come to India, they are exposed to more of their family relatives and with other children, and with therapy I had almost 90-95% success rate, provided they followed all our recommendations. See, the answer is yes. When you are away from your home, you are by yourself and you're going through a lot of changes. It's called the cultural shock happening, especially in the Western world. You don't have anyone to support you. So you're going through a lot of anxiety, mental torture. You have to come up in life, you have to compete with all these other people to prove that you have the skill set to work here. So what happens to you? So you pass on that anxiety to your family. And what happens to a growing child? You don't have anyone to help you with the child. So you take care of, the household work. It's called the 4-wall syndrome in housewives. They turn on the TV, they make the child sit in front of the TV, even the feeding, the whole day, and their mother is busy taking care of the rest of the work. So after, typically this happens, around the first year, and the child gets addicted or attracted to the screen, because in the 70s and 80s, our TV screen was moving very slowly, one screen, one picture at a time. Today, in today's world, we have tablet, mobile phone, and your TV running. And even in the TV, for every half a second, there is a movement happening. So what happens to the growing brain, So it gets agitated, and there is no 2-way communication. It's only 1-way communication. And typically, your receptive center in the brain gets suppressed. You need to have more stimulation for the network to happen and for you to develop, your communication skills. Sorry?
Shanti madam, you have to mute yourself, madam. Shanti madam, we are able to hear you.
Yeah, so there is no 2-way communication, and now they are slowly changing in the US. So now that they've learned in the 2000s, right? They know what is happening to the kids. So slowly they are coming out and they are saying, my kid is getting better, because we recommend putting the child in a daycare, play school, or like a gymboree or some kind of group activity. They are getting better. I do not have any studies to prove that there is a difference between the rural and the urban setup. I will show you more studies and more research papers when I talk about autism. Yeah. So do you want me to play the questions, or you want to finish Dr. Malaraj's slides?
No. Mala has a lot of slides, but I think the scope of this is she has slides on fibroids and on endometriosis, but I think for the forum which is here, that is actually not needed. I think, Geeta ma'am, do you think we should just share knowledge and stop sharing slides?
It's a thumbs up. It's a thumbs up from Dr. Geeta. So let me go ahead, play the questions we talked about yesterday. so that, you know, we can have answers from two expertise, that is Dr. Sumati Premanan and Dr. Geeta Arjun.
Can we stop sharing the screen?
Yeah, sure.
பெண்கள் அதாவது சிறு குழந்தை.
Stop
Let
sharing.
me play it again. Sumati,
Yeah,
stop sharing.
Yeah, I will.
Dr. Geeta, are you listening? I'm playing the question now.
சமீப காலமா வந்து பெண்கள் அதாவது சிறு குழந்தைகள்னு சொல்ல முடியாது, ஆனா கொஞ்சம் வளர்ந்து ஒரு 7 இருந்து 10 வயசுக்குள்ளே வந்து பெண்கள் சிறு பெண்கள் வந்து வயசுக்கு வந்துடுறாங்க. இது என்ன விதமான பிரச்சனைனால இந்த மாதிரி சீக்கிரமா வயசுக்கு வராங்க? இது நல்லதா இல்ல கெட்டதா? இதை நம்ம அவாய்ட் பண்ணணுமா இல்ல இதை நம்ம அக்செப்ட் பண்ணிக்கணுமா? இது உடல்லையும் மனசுலையும் வந்து இந்த குழந்தைகளுக்கு எந்த விதமான மாற்றங்களை இது ஏற்படுத்தும்? பிற்காலத்துல இந்த மாதிரி சீக்கிரமா வயசுக்கு வர்றதுனால அவங்களுக்கு ஏதாவது சங்கடங்கள் நேருமா? சமீப காலமா வந்து
So I'll go first. As a pediatrician, I'm seeing a lot of kids, significant numbers, you know, starting their menarche from age 7. So in our AAP and other, you know, academies, we used to start for precocious puberty workup. We used to take, you know, the bone age, and we did the hormonal studies. You know, if we see hair in the private part, or, you know, under the, armpits, breast buds, you know. Now it is official, you know, in African American and Hispanic, if there is a family history, attaining, starting puberty and attaining menarche at the age 7, it is normal. But the child is a child, and there is physical development, but mental age, they are like a 7-year-old or an 8-year-old. And there's a big risk for child abuse, you know, sexual abuse, because the child is developing breast, and you know, they can get pregnant. It's so shocking. You know, I've had an 11-year-old who was pregnant, and we had an 8th grader who delivered a baby in the restroom. She thought she went to poop, but she had a baby in the toilet, and the school went and found out a newborn in the toilet. I'm getting goosebumps. You know, what do we do as a child specialist? I'm so scared to look at these children in the future. Go ahead, Dr. Geeta.
So இது கரெக்டா இல்லையான்னு டெஃபினட்டா கரெக்ட் இல்லை. இப்போ நம்ம as far as Indians are concerned, நம்ம 8 வயசுக்கு முன்னாடி பீரியட்ஸ் வருதுன்னா அது டெஃபினட்டா ப்ரிகாஷியஸ் பியூபர்ட்டி தான். ஸோ 6 வயசு 7 வயசுல அந்த குழந்தைக்கு பெரிய இந்த இதெல்லாம் சேஞ்சஸ் வர ஆரம்பிச்சிடுதுன்னா we have to go see a doctor and find out if we can stop it, can we postpone it. அது பண்ண முடியும். The reason for this is happening, இது மாதிரி சீக்கிரம் வர்றதுனால எது காரணம்னா weight ஏறுறது. Children are putting on weight much earlier. ஒரு it used to be that இப்போ எங்க அம்மா காலத்துலலாம் 14, 15, 16 was very common to have period starting. அது எதனாலனா அந்த வெயிட்டே அதுங்க, because people at that age were in those days were much thinner. இப்போ என்ன ஆகுதுன்னா there is a what is known as a threshold weight. அந்த weight வந்தப்புறம் அந்த பாடியில fat இருக்கும்போது there are certain changes that happen. அந்த that weight is the children are reaching much earlier, and இது parents have to be very careful. That weight obesity எல்லாம் childhoodலயே ஆரம்பிக்கிறது. ஸோ ரொம்ப கேர்ஃபுல்லா இருக்கணும், அது பார்த்து தான் ஆகணும். will it harm the baby? அது ஒரு வயசுக்கு ஒரு certain ஏஜ்க்கு முன்னாடி ஆச்சுன்னா ஆமா, because this child will not have the full growth. அந்த estrogen produce ஆக ஆரம்பிச்சதுன்னா பேபிக்கு அந்த போன்ஸ் எல்லாம் ஃபியூஸ் ஆயிடும். தட் இஸ் அந்த ஒரு அளவுக்கு மேல வளராது அந்த குழந்தை, ஹைட் வராது. ஸோ எஸ், இட் இஸ் ஹார்ம்ஃபுல் மென்டலி, எமோஷனலி. அஃப்கோர்ஸ் 8 வயசுல 9 வயசுல குழந்தைக்கு இதெல்லாம் வருதுன்னா இட் இஸ் ஹார்ம்ஃபுல் எமோஷனலி. ஸோ நம்ம certainly weight பார்த்துக்கணும். There is one more reason, and that they're talking about, especially in the Western, especially American children, they're exposed to estrogen in meat. இப்போ அவங்க the cowsக்கு pigsக்கு எல்லாத்துக்கும் நிறைய estrogens கொடுக்குறாங்க to make them fat because estrogen makes you fat. So அந்த estrogen எல்லாம் it comes into these children's body, and that's why African American and Hispanics are getting periods earlier, because when you are poorer you cannot afford healthy food. You eat much more of junk food, of carbs, of cheap meats, cheap fatty meats, and therefore your estrogen levels go up, and it's a public health issue that Americans should deal with, which they are not. So anyway, that's a political.
Thank you so much. Let me play the next question.
இப்போது இருக்கக்கூடிய லாக்டவுன் சுச்சுவேஷன்ல குழந்தைகள் எல்லாமே வந்து வீட்லயே இருந்து ஆன்லைன் கிளாஸஸ் வந்து அட்டென்ட் பண்றாங்க. அவங்களுக்கு ஸ்கூலுக்கோ இல்லை காலேஜுக்கோ போகக்கூடிய சந்தர்ப்பங்கள் வந்து இல்லை. வீட்டில் இருந்தபடி தான் படிக்கிறாங்க. இது எந்த விதமான பிரச்சனைகளை அவங்களுக்கு உடல் அளவிலையும் மனதளவிலையும் ஏற்படுத்தும்? இப்போ
So I will answer that question, because in the US we are starting to reopen our schools. This week we had online classes, so the parent has to choose. So as it is, I live in Texas. My son lives in Seattle, Washington. The epicenter for COVID in the US started in Seattle in January. So we are in August now. It's been almost 8 months. And people who live in certain state, right, Washington state, they were the first ones to go on lockdown. So when you're inside the house, when you're stuck, what happens to you? You do not have a routine. You do not have a daily schedule. You go to sleep, you do whatever you want to do. People who are asked to work from home, they work 24 hours sometimes. Otherwise they play games all day, and they procrastinate. They wait till the deadline and then they do it, day and night. So if there is no routine, there is no self-discipline. If you don't have a self-discipline, I mean, you're eating like whatever you want. But the good thing is, most of the shops were closed. They were doing online shopping, but Walmart was open, and there was no toilet paper and there was nothing in the shelf. They all got sold out. So they were, actually speaking, I have to tell you the pros and cons. I was telling you, the cons, right? So definitely there was a problem with the health, physical health, mental health. But look at the positive side. When you are home, you are running like a machine so far, and you are home with your kids. It's a family time. So people, they made use of this opportunity to connect with the family. So the family bonding got better, and some family, they had a family time together. They were sitting for the breakfast, lunch, and dinner together. This is all because of the smart mothers. Women who are like smarter, they made use of this opportunity, and they are doing much better. But on the other extreme, children who are not, made to do a routine every day, especially teenagers, they had fun. They were on the phone all day. They were not sleeping. And this month, I've been seeing children for their school physicals. So the first thing I noticed was the weight gain. Universally, all the children and all of us, because of the lockdown, our weight increased. For those people who were exercising, who are watching the diet, they were healthy. Otherwise, the significant number all over the world increase in obesity. Number 2, mental health, big time. Even yesterday, I had a child, I had to refer her to the emergency because she was so depressed. In fact, during COVID times, the 16-year-old got pregnant, teenage pregnancy, and she had to go for an abortion, and she went into a major depression. She wanted to commit suicide. So this is the other extreme I'm talking about. But the COVID is not going away. This is what I tell my parents and my kids. Number 1, it is what it is. You have to accept COVID is going to be here for another 2 years. Even Bill Gates, when he talked, he says, COVID is not going away. You have to accept to live with it. You have to follow whatever the CDC is recommending, WHO is recommending, keep the social distancing. Once you leave your house, keep the face mask on, keep washing your hands, and do not touch your face. So this is what I talk to all my kids who come to my practice. And the first thing I ask is, how are you doing during this uncertain times of COVID pandemic? They're all opening up, and some parents are crying because they lost their job. They don't have money. So I try to empathize with them. I tell them, you're not alone. We are with you. Even the healthcare professionals, we are scared. We don't know what's going to happen. Coming back to the question, back to school. So these kids, they're coming and they're coming back to school, right? So I ask them, are you comfortable going back to school? Do you want to do online or do you want to do in person? When I talk to the parents, 50% they say, oh my God, I've had enough. Let them go back. I can't handle this anymore because I'm having a meltdown. I can't take it anymore, you know? So 50% are ready to send the school back to school in person. So what's going to happen? We are going to have a huge second wave. And I'm so nervous because flu season starts from late September. October, you're going to have more cases of COVID together. Okay, so influenza with corona. I call it flurona. So you're going to have combinations also. So we don't know what's going to happen. I'm recommending flu shots for all my kids. We used to give mainly for the kids with allergy, asthma, but now I'm recommending all the kids shot, to prevent complications of flu in those who get corona. We have had infections also, co-infection. I don't know who is on unmute. Please mute yourself. Thank you. So the other 50%, they are saying, I am not comfortable sending my child back to school. And if you see, if you Google it, in certain states, you know, Georgia, Atlanta, you see the high schoolers, they're not wearing masks. They are having COVID parties. They want to get exposed. They want to get the infection. And that's how they say they're going to develop immunity as well. So back to the question, we have 50%, they're okay. 50% they're not okay. We'll have to wait and see. So we'll have another session maybe next year to see, you know, retrospectively how they managed going back to school. Yeah. Okay. Any other comments? I just have a last question. We are running out of time because we have to do one more presentation. This is a very important question. I thought, you know, our audience will benefit, and that's what we practice. I'm sorry.
Perimenopausal age group.
No, I wanted to discuss on the vaccination.
பிரச்சனைகளை பெண்கள் எந்த கேன்சரை தடுப்பதற்கு பெண்களால் முடியும்? மார்பகத்தில் எந்த விதமான பிரச்சனைகள்?
Sorry about that. So the question was, எந்த கேன்சரை நம்ம தடுக்க முடியும்? So because I'm a pediatrician and the talk is on women's health, we have started doing HPV from age 9 to 10 years. So we want to catch the preteens, and we give two doses of HPV to prevent cervical cancer in girls and prevention of genital warts in boys. It's a standard, but it is optional. So if you choose not to do it, we can't force the parent to take the shot. So your thoughts as a gynecologist, Sumati?
Okay, that's a very important question. எந்த கேன்சரை தடுக்க முடியும் அப்படின்னா வந்து எந்த கேன்சருக்காவது மருந்து இருந்தா மாத்திரம் தான் தடுக்க முடியும் இல்லையா? ஸோ எந்த கேன்சருக்கு வந்துட்டு வேக்சின் இருக்குன்னா இப்போ ஹெச்பிவி வேக்சின் மாத்திரம்தான் வந்து we have. வேற வேக்சின் நம்ம கிட்ட இல்லை. அந்த வேக்சின்னால நம்மளுக்கு ஃபுல்லா பெனிஃபிட் இருக்கா அப்படின்னா அந்த வேக்சின் at the earliest, before they start, even before they start their sexual life. See, that varies. Patients இங்க இருக்கக்கூடிய பாப்புலேஷன், இந்தியாவில் இருக்கக்கூடிய பாப்புலேஷன் பத்தி மாத்திரம் நான் பேசுறேன். We assume that they start sex after marriage, which is not true. We just assume. Most gynecologists all over the world will be facing a problem of unwanted pregnancy in teenage before marriage. And as Shanti had earlier mentioned, all the more problem when they are going to have a menarche, which is very early. அவங்க வயசுக்கு வர்றதே சீக்கிரமா வந்ததுன்னா அவங்களுடைய செக்ஷுவல் எக்ஸ்போஷர் மோஸ்ட் ப்ராபப்ளி சீக்கிரமா இருக்கிறதுக்கான வாய்ப்புகள் இருக்கு. அவங்க அதை தடுக்க போறாங்களா இல்ல. ஸோ வேற என்ன பண்ண முடியும்? அவங்களுக்கு வேக்சினேஷன் பண்றது மூலமா நம்ம வந்து அவங்களுக்கு வரக்கூடிய அந்த வைரஸ், ஏன்னா மற்ற கேன்சருக்கெல்லாம் காரணம் என்னன்னு பார்த்தா நிறைய கேன்சருக்கு காரணங்கள் தெரியாது. ஸ்மோக்கிங் காரணமா இருக்கலாம், ஆல்கஹால் காரணமா இருக்கலாம், ஜெனட்டிக்ஸ் காரணமா இருக்கலாம். இதெல்லாம் வந்துட்டு ஒண்ணு ப்ரிவென்ட் பண்ண முடியும், இன்னொன்னு ப்ரிவென்ட் பண்ண முடியாது. பட் ஆனா இந்த ஒரு கேன்சர் கர்ப்பப்பை வாயில வரக்கூடிய அந்த யூட்ரைன் சர்விக்ஸ்ல வரக்கூடிய சர்வைக்கல் கேன்சருக்கு மாத்திரம்தான் the cause is a virus. Like how COVID has a virus, the cause of cervical cancer is a virus. But only thing is, and the virus enters very early in stage. But உடனே வந்து இன்னைக்கு கொரோனா நமக்கு வந்தது அப்படின்னா வந்துட்டு we will be probably getting the infection which is exposed. We will already know in a week whether we are affected by it or not. ஆனா அந்த இன்ஃபெக்ஷன் வரும்போது it is going to take quite some time, probably 5 years, 10 years, 15 years down the line. அது கொஞ்சம் கொஞ்சமா மாற்றங்களை ஏற்படுத்தி ப்ரீ கேன்சர் ஸ்டேஜுக்கு போயிட்டு அதுக்கப்புறமா தான் கேன்சருக்கு போகுது. ஸோ இட் கிவ்ஸ் அஸ் அ பிக் டைம் கேப், ப்ராபப்ளி 5 to 10 years நமக்கு கேப் கொடுக்குது. ஸோ தட் இஸ் த டைம் we have to catch women. Most probably when in school, cervical cancer vaccination is the only thing which can prevent the cancer. மற்றபடிக்கு breast cancerன்னு சொல்லி எடுத்துக்கிட்டீங்க அப்படின்னா ஐடென்டிஃபிகேஷன் ஆஃப் அ ப்ராப்ளம் விச் இஸ் ஆல்ரெடி தேர். ஸோ ஒரு breast lump சின்னதா இருக்கும்போது வரதுக்கு முன்னாடி தடுக்க முடியாது. ப்ராபப்ளி தே கேன் டு ஆஞ்சலினா ஜோலி எல்லாம் என்ன பண்ணாங்க, அவங்க வந்து she went in for screening because she had a very strong family history. So she went ahead and screened and she found that she was probably going to get somewhere around 93% of time she probably would be developing a breast cancer. So she went ahead and had a very drastic thing done, which any woman would probably be scared, worried to do. Her thing was, let me be alive without the disease. And then she underwent plastic surgery. Then she has implant. That's a different story. But that requires the mindset. Am I going to get cancer or not? Any one of us can get cancer in any one of the part of the body. Which cancer is identifiable? Which cancer is identifiable at the earliest? Which cancer is preventable? If our education system, if our policies are able to determine, and if the pharma comes together to bring about products for early diagnosis, education, and screening, and vaccination, and a good treatment, that would be, this is a major contributor of, cancer is a major contributor of a non-communicable disease. Communicable diseases செத்து போய் 40 வயசுல செத்து போனவங்க, 50 வயசுல செத்து போனவங்க, 60 வயசுல செத்து போனவங்க எல்லாம் போயிட்டு இப்ப we are living longer. So how are we going to die? Aging, diseases, most of us are probably going to develop cancers later on. Fine? At some point of time, we need to die. Apart from aging process, what other thing is going to affect us? The lifestyle disorders like obesity, diabetes, hypertension, cholesterol, cardiovascular problem, osteoporosis, fracture, falling down, unable to get operated, bedridden, death. None of us want to have any sort of a thing. This is one side. The other side is, it's absolutely out of our control. Cancers. Are we able to prevent a cancer? Yes, one cancer, which is cervical cancer. Will we be able to identify a cancer in an early stage? Yes. Probably recognizing your menstrual symptoms, breast symptoms, any lumps, anything which is different from what you already have in your body. அதை வந்து இக்னோர் பண்ணாம to go for early screening, வெக்கப்படாம கூச்சப்படாம இதுதான் என்னுடைய ப்ராப்ளம், இதுக்கு எனக்கு என்ன செய்யணும் அப்படின்னு செய்யக்கூடிய ஒரு மனப்பக்குவம் வரணும் அப்படின்னா then comes empowerment. See, ultimately, it's all intermingled. And if we are able to bring about education as a cornerstone, and if we have the right policies, and if the policies, Selvaraj sir, are you online? I want
Yeah.
to hear you are here particularly for a reason.
Yeah,
Okay.
definitely. I'm hearing
You
you.
have to have policies which reach the people correctly. If the
Correct.
funds are there, the funds have to reach people correctly and in the way it was meant to be. The taxpayers' money has to reach the person's home.
Well said, Sumati. I'm sorry to interrupt.
Connect
We are
everything.
running out of time,
Connect-
Sumati. I
Yeah,
have another
sure,
program.
fine.
Sorry. Thank you so
Yeah,
much.
fine.
Well said. Well said. Thank you so much for filling in, and I appreciate all your efforts. And I thank you from the bottom of my heart. I'm really touched. I wish we continue to do this more and more. Because maybe we can do like a parallel. I want like women's health and children's health to go together. And I thank Dr. Selvaraju because the reason I have Dr. Selvaraju is to reach the whole of Tamil Nadu. I'm sure the whole of Tamil Nadu is watching him because we shared to his timeline as well. So I want my project Marlight to reach all the children in the world, especially to our kids in the state of Tamil Nadu. Thank you so much.
Well, Shanti, Dr. Shanti, can you hear me?
Sure.
Shanti, the thing is, next time we'll have meeting in Tamil.
ஆமா,
So that our
கண்டிப்பா,
people can...
கண்டிப்பா. Actually, இனி அடுத்தது வந்து இப்ப தமிழ்ல தான் பேச போறோம். இப்போ நான் வந்து next speaker introduce பண்றது வந்து Mrs. Vasanthi Anand. I'm so proud to say our team has 31 members now. We have expertise from different specialities, and I have 10 volunteers working from different parts of the world. And I'm so proud to introduce Mrs. Vasanthi Anand, who's heading now the parent support group. Over to Mrs. Vasanthi.
Thanks, Dr. Shanti Raj. First of all, I would like to congratulate Dr. Shanti Raj for this great initiative. I'm very, very happy to be part of this Project Marley group and taking care of this parent support group. It's a very big responsibility, I know that, and I would like to help as much as possible. It has been my passion to work in this field, and I think to some extent it has come true. Okay. We are in the process of developing a website for Project Marley, and a portion of that is going to be a parent support group. In the parent support group, we are going to have a discussion forum group so that parents can exchange their views, their grievances, whatever issues they have. It will be a peer-to-peer discussion. So we are aiming at parents who are going to have autistic children to be able to converse with other fellow parents who have similar issues. So we are trying to establish a platform so the parents can communicate with each other. Any grievances or any autistic related topics. We are also trying to create a database with useful resources for the parents. So it will be like an encyclopedia or thesaurus for autistic related issues. So we are in the process. If the website is in its infant stage at the moment, we have just about started it, and there's a long process. And once it is completely up and running, we will have contact numbers, email IDs, so the parents can directly get in touch with the parent support group, and we can offer them whatever assistance they want. The first thing that I want to do in the parent support group is to introduce Ms. Ramamani, who has an autistic child. And she has been very, very kind to have given us a video about her experience with her son. Ramamani is mother of, as she herself says, I'm mother of Niranjan Ravi. And he is a 35-year-old person in the autistic spectrum. She is actually a chartered accountant, and she has also got a legal qualification, law. She's done law, and she's also a qualified special educator, certified by the Rehabilitation Council of India. she has started this trust called Sarvamangala Bihar Trust. And it has been formed entirely with this in mind, that they need to create a place for adults with special needs to live in after their parents. So right now, there are not many centers which offer such assistance to special needs adults. She's a wonderful human being, and she's very, very down to earth. She has dedicated her entire life for her son. So let us listen to her now. Shanti, I'm sharing my screen.
Sure.
A very good day
Just 1 second.
to all. என் பேர் ரமாமணி ரவி, நிரஞ்சனோட அம்மா. இந்த 35 வருஷத்துல அவன் என்னெல்லாம் எனக்கு கத்து கொடுத்துருக்கான்றத உங்களோட ஷேர் பண்ணிக்கணும்னு ஆசைப்படுறேன். இது உங்க எல்லாருக்குமே ஏதாவது ஒரு விதத்துல பிரயோஜனமா இருக்கும்ன்றதையும் நான் நம்புறேன். அந்த டைம்ல இன்டர்நெட், வாட்ஸ்அப், யூடியூப் இது எதுவுமே இல்லாத ஒரு டைம். ஆட்டிசம்னா என்னன்னே புரியாம இருந்த ஒரு லெவல்ல இருந்து நாங்க ஆரம்பிச்சிருக்கோம். இந்த ஜேர்னில மெயினா டிவைன் கிரேஸ், நிறைய எஜுகேட்டர்ஸ், டாக்டர்ஸ், தெரபிஸ்ட் எல்லாரும் எங்க கூட சேர்ந்து டிராவல் பண்ணதுல இந்த ஜேர்னி அச்சீவ் பண்ணியிருக்கோம். டயக்னாசிஸ்ன்னு பார்த்தீங்கன்னா 5 இயர்ஸ்ல தான் ஆட்டிசம் டயக்னாசிஸ் வந்தது. ஆனா 1.5 அவன் கொஞ்சம் பார்க்கறதுக்கு நார்மலா இருந்தாலும் டிஃப்ரெண்டா பிஹேவ் பண்றான்றது வீட்டுல இருக்கிற பெரியவாள்லாம் சொல்லி அப்போலேருந்தே அவனோட ஒர்க் பண்ண ஆரம்பிச்சாச்சு. அந்த ஸ்டேஜ்ல மெயினா எடுக்க வேண்டிய டெசிஷன் 2 ப்ரொஃபஷனல் டிகிரிஸ், சார்ட்டர்ட் அக்கௌண்டன்சி அண்ட் லா வச்சுட்டு ஒரு சாதாரண மிடில் கிளாஸ் ஃபேமிலியிலேருந்து வந்த ஒரு பர்சனுக்கு ப்ரொஃபஷனை பர்சியூ பண்றதா இல்ல என்ன பண்ணலாம், அவனை எப்படி வழி நடத்தலாம்னு யோசிச்சதுல அம்மாவா அவனுக்கு ஒரு மனுஷனா ஆக்கணும்ன்றது மட்டும்தான் எனக்கு ரொம்ப முக்கியமான ஒரு குறிக்கோளா தோணித்து. எந்த ப்ரொஃபஷனை விட்டும் என்ன சம்பாதிச்சிருப்போம், என்ன தியாகம் பண்ணிருக்கோம், அதெல்லாம் பெருசா தோணல. இன்ஸ்டெட் அவனை எப்படி ஒரு நல்ல ஒரு பர்சனா ஆக்கலாம் அப்படிங்கிறது தான் ஒரு முக்கியமான ஒரு விஷயமா தோணுது. அன்னிலேருந்து in all this 35 years ஏதோ ஒரு இன்ட்யூட்டிவ் மைண்ட், மனசுல கடவுள் ஏதோ ஒரு விதத்துல கைட் பண்ணிட்டே வந்திருக்கார் என்ன பண்ணணும் அப்படிங்கறத. அதுதான் எங்களுக்கு ஒரு லீடிங் லைட் மாதிரி இருந்திருக்கு. யார் கேட்டாலுமே என்ன டெக்னிக் யூஸ் பண்ணீங்கோ, என்ன ஸ்ட்ராட்டஜி, என்ன மெத்தடாலஜி அப்படி எல்லாம் யோசிக்க தோன்றது. ஆனா அது எதுவா இருந்தாலும் கன்சிஸ்டண்டா, அதாவது விடாமுயற்சியோட தினம் பண்றதுதான் அதோட அந்த வெற்றியோட சீக்ரெட். இன்னைக்கு பண்ணோம் ஒன்னும் நடக்கல அப்படிங்கிறது சரி வராது. அதனால இன்னைக்கு நம்மளோட அல்டிமேட் கோல் அவனை இண்டிபெண்டன்டா ஆக்கணும்ன்றது. அந்த கோலுக்கு போறதுக்கு நம்ம எப்படி இன்னியோட பொழுத நம்ம யூஸ் பண்ணுவோம், அதுல நம்ம எப்படி மாத்திண்டா அந்த கோலை நம்ம கொஞ்சமாவது அச்சீவ் பண்ணுவோன்றதுதான் எனக்கு தோணித்து. அந்தந்த ஏஜுக்கு ஏத்தாப்புல நம்ம சில கோல்ஸை செட் பண்றோம். ஒரு 3 வயசு குழந்தைக்கு ஏத்த கோல்ஸ் ஃபார் 3 year, 5 year, 10 year. ஸோ அந்த சப் கோல்ஸை வச்சுட்டு தான் நம்ம நம்ம மெயின் கோலை அடைய முடியும். அண்ட் இது வேற யாராலுமே பண்ண முடியாது. ஏன்னா 24 hours ஜாப் இது ஒரு பேரண்டோ அந்த ஃபேமிலி சப்போர்ட் வச்சுட்டு தான் இது நடக்க முடியும். அண்ட் கண்டிப்பா ஒரு பேரண்டாலையும் இது முடியும். இது சொல்றதுக்கு தான் நான் இங்க இருக்கேன். அந்த குழந்தை எந்த ஏஜா இருந்தாலும், என்ன டயக்னாசிஸா இருந்தாலும், எந்த லெவல்ல இருந்தாலும் கண்டிப்பா அவனோட வாழ்க்கையில நம்ம ஒரு மாற்றத்தை உருவாக்க முடியும். அண்ட் வயசாக ஆக அந்த மெச்சூரிட்டி வர வர அந்த குழந்தையும் தானா நன்னா இம்ப்ரூவ் ஆகுது. இதெல்லாம் எந்த புக்கை படிச்சோ இல்லைன்னா ஏதாவது வச்சு நான் சொல்லல. என்னோட வாழ்க்கை அனுபவத்தை உங்களுக்கு தைரியம் கொடுக்கறதுக்கும் உங்களுக்கு ஒரு நம்பிக்கை கொடுக்கறதுக்கும் தான் நான் இங்க இருக்கேன். தேங்க்யூ.
Back to you, Shanti.
Brilliant, brilliant. So touching, so touching. Thank
So
you.
natural from the heart. That's the thing.
Yeah. I'm sure we are reaching a lot more through her, you know. So this is what I want. This is what I want. There's no point talking about the theory of it. You know, I can tell you like there's so many reasons of autism, but it is very, very important because we need to talk about prevention, like the PCOS, right? So there's a link between PCOS and autism in the future. So if you're able to take care of your health, even pre-pregnancy, you know, I want to catch them young. That is the key here. So if you're going to talk to kids, you know, starting from their preteen, talk about their hygiene, health, mental health, and physical health, and how to live like a successful life. And then the career women, don't get burnt. We'll have another topic, you know, on working women like us, career women, and what we went through, you know, our personal stories and how we can share our story with others for them to come up in their lives. So thank you so much all. I think we are finishing on dot 4 minutes extra. Okay. So if you have anything to share, feel free. The floor is open. Shanti?
Which Shanti? There are three
Sai Ram.
today.
Yeah. One Shanti is talking. Thank you so much, Selvaraj. Yeah, thank you.
Shanti, how are you?
Good,
I'm
good.
very good. Thank you. Thank you, Selvaraj.
Where are
Thank
you?
you.
You are in Chennai or somewhere else?
I'm in the UAE. I'm in Dubai.
Okay. What about Sai?
Same.
She's
Sai-
married to Sai.
Yes. I'm
No,
hoping
I
he's
know.
living with me.
No, he was at Kaveri, no?
Enapa? He was.
He was at Kaveri Hospital. Eh?
Illa,
Sai.
illa. Moved. Once we moved, we are all in Dubai.
Okay.
Shanti, fantastic project. Very glad to be part of it. Extremely proud that as our batch, 1983 batch, we have actually done this. And for the rest of you who don't know, a lot of us in this group are actually classmates, and we are immensely proud to support Shanti in this project. We had a fantastic talk. I think Dr. Geeta had to leave, and thank you so much, Dr. Sumati Premanand. I think it was a very sensible move to actually say, let's do the questions. Primarily because I think that added so much more value. I'm sure we can have Mala Raj again back on stage with us, and she will be able to put more light on the topics that she prepared. But I think all in all, fantastic meeting. I think, like you said, we should do more of these.
Okay, thank you so much. Sashikala, so nice to see you from London. Thanks for joining. Would you like to say a few words, please?
Yeah. I'm so happy I just joined the right moment. ஏன்னா என்னோட பேஷன் வந்து இப்போ I'm doing naturopathy. I'm a gynecologist. I know I couldn't treat any of my PCOS here. சும்மா clomid குத்துன்னு தான் இருக்கிறோம். We have our weight reduction, இதெல்லாம் nothing worked. I was so frustrated. I was looking at what are the other means I could help them. They literally come and cry. We have the age limitation, we couldn't help. IVF limitation. Only IVF was this or clomid. மற்றபடி ஒண்ணுமே இல்லை NHSல. So it pushed me into that, and I went and searched. I did all the research to see which diet or all this, all this Atkins, everything I searched. Nothing was actually very, very effective. It pushed me into naturopathy, and they offered it. Then got into the depth of it. As you are coming PCO, இன்னும் அதுக்கும் ஒரு முன்னாடி ஒரு ஸ்டேட் இருக்கு. So it's all about what we eat, how we live. It's a toxins. Toxins leads to hormone imbalance. Toxin leads to cellular proliferation, and that leads to cancer. And it just messes up the whole life. It's just not PCOS, it's not autism. Ella lifestyle disorders, everything is from the environmental issues, and the diet. Starting from the air we breathe in, the food we eat, எல்லாமே இருக்கு. You don't have much choice because the way they teach us, ஒரு ப்ராடக்ட் நம்ம ப்ராசஸ் ஃபுட், ரெடிமேட் ஃபுட், பேக்கெட் ஃபுட், ஷெல்ஃப் ஃபுட் அப்படின்னு போய் எடுத்தோம்னாலே you're consuming poison. முடிஞ்சு போச்சு அதுல. இது தெரிஞ்சோன்னா எனக்கு அப்படியே ஹியூஜ் ஷாக். Where would you start to prevent it? Only education. Education தான் பண்ண வேண்டியது. So my lifestyle changed actually. I'm looking at what I'm giving to my children, what they are eating. My son who went to Cambridge and all, we never used to like Indian food. Always rice. So I changed my lifestyle, changed the food the way I cook. Now he say, Mom, what are you putting? You're mixing something. It's so magic. Only fresh food. Because I converted into vegetarian. Initially I thought, sambar parpu mattu dhaan irukku. Now with all this herbs and vegetables, you can create. It's so creative. And when you know the ingredients which we use, starting from mustard, starting from the talipu which we do, I used to put away because of the Indian smell of now. And then I went into Western food. Now back to the same thing, that one little talipu, the tadka, whatever they call, it's a detoxification. It's a detox. All those little ingredients you put. So I study all those ingredients and what is the effect, what exactly the element is there, what it does. It is such a fascinating subject. You can prevent all the disorders and so many disorders. That's very interesting when you say how it goes. It's amazing thing and it's never ending subject, but we can prevent, we can be disease free. You don't have to, being a doctor, when I say this, people are like looking at me funny, but I'm saying I want people not to have this. I don't want to be chopping all your organs when you come to me. I want to prevent it. So breast cancer, liver, the endometrial cancer, ovarian cancer, cervical cancer, cervical cancer, see when what they tell is when you have a pap smear, when a reproductive women, when the sperm is, it's an antigen. So it comes with the immunosuppressant state. When we do a pap smear, the cell is trying to, at the cervical level, it's trying to heal with immunity. But at that time, women should protect themselves from having intercourse because the semen is an antigen coming in. So to accept it, the body has to then identify, okay, it has an immunosuppressive effect. And that can cause cervical. That particular period, if they keep on doing it, inflammation and whatever the abrasion is there, the healing doesn't take place. And when this antigen comes in, the immunity is reduced, and therefore that again leads to cancer. So that's why they say repeated sexual intercourse, multiple partners. Now that looks differently, but actually there is a scientific reason how this is. So we go in the naturopathy ways. It's all evidence-based now. It's more in US, it's more in Australia, not much in UK. So I'm not taking much time. It's fascinating, but there is a light in the tunnel. We know how to do it. We have to, I'm so happy this group is embracing everything. It's a holistic approach and I really love it.
Thank you so much, Sashi. It's just the beginning, Sashi. It's just the beginning.
It's the beginning.
I'm so happy, to see you here, and we think alike, so we can join hands together. You're not going away, you're going to be one of the speakers for naturopathy, because even in the US, in Texas, we have natural pediatric centers. They don't want to give antibiotics. They talk about detox. They talk about only the healthy diet now. So in fact, I am promoting yoga and meditation, mindfulness to all my kids and parents. I teach them what's called the 7-11 breathing. So it's so simple. So they come in for the checkup and the blood pressure is so high. So I enter, I just tell them, look at me. I have my mask, my visor, and my PPE, everything. I put double gloves actually, so I don't want to carry any infection home. So I tell them, let's all breathe. Okay, because we are not doing that. We are like short breathing, right? So let's all take a deep breath, and I teach them inhale 7, exhale 11 for 5 times, and then I check the blood pressure. She's fine. The child is fine. And next, I'm teaching them yoga. In fact, by God's grace, I should be able to get Sadhguru Jackie Vasudev, Isha. I just got a link. I mean, I just connected. So I'm planning to invite him. I listen to him every day in the morning and evening when I drive to work. So he's inside my mind. So I want to practice whatever he's preaching. You know, I have to set an example first to spread the news, right? So that is one. And I want to follow our ancestors. My grandfather lived till the age 103, and we celebrated. He has evlo grandkids, Sumati? 50 number? 50, yeah, 50 pera. Yeah. We all celebrated his 100th birthday, and the youngest grandchild cut the cake. Till his last day, he never took any medicines. In fact, he had chicken biryani. Night, 12 மணிக்கு கூட சாப்பிடுவார். பல்லு clean-ஆ இருக்கும். He used to exercise every day. Sunlight-ல வந்து துளசி மாடத்துக்கு முன்னாடி exercise பண்ணுவார். So I want to bring that culture back to our lives and to spread the, you know, the message to everyone. So healthy food, you know, the diet, exercise, and good night sleep, and a good heart. You have to be pure here. And we want to empathize and be compassionate. After all, you know, life is so short. We all go through the same kind of life. You're happy one day, you're up, you're elated, and the next day you're down. And it goes on, you know. So I'm so happy. I want to conclude our program. And
Hey, one second, Sasi.
Hello.
How are you?
Nice seeing you.
எப்படி இருக்க? ரொம்ப
I'm
வருஷம் ஆச்சு.
fine.
30 years after a long time, you know.
Yeah, I remember you calling me professor, coming, flying visit கொடுத்துட்டு போவேன் clinic. Those days
Okay.
are fine. Yeah.
Very nice, very nice.
Nice place to see
பாத்துக்குங்க,
you.
உடம்ப பாத்துக்குங்க.
Yeah, yeah. எல்லாம் healthy modeல போயிட்டு இப்போ ஒண்ணும் பிரச்சனையே கிடையாது.
செல்வராஜ் இப்ப catch-up modeல இருக்காருன்னு நினைக்கிறேன்.
yeah, so we have our Stanley group and awesome Stanley girls group. ரெண்டு குரூப்லயும் நிறைய போயிட்டு இருந்தது. I'm glad to see you, Sashi, you know, in an excellent shape. Your spirit, excellence.
அதெல்லாம் goes to credit to Sadhguru. So many people are there.
You are with me, right? Sadhguru, right? Yes. So Maralai, the laughter of children is universally uplifting. Sound of children playing evokes ideal of a simple and pure act. We can all take comfort in the optimism of children. Their rejoicing can gladden us all. So the next program will be on fetal health by Dr. Shanti Saira. And we are going to have another speaker, hopefully a genetic specialist, to talk about some other issues. So till we meet again on September 12th, Saturday evening, same time, so long. Namaste.
Namaskaram. Vanakkam.
Thank you.
Thank you.
நன்றி சாந்தி.
Nice.